Oh, what? What? You know, I'm standing in a parking lot just another day, and I'm rapping about herpes. What can I say? Because I got it everywhere, and it's on my lips.
Excuse me. Did I just hear you talking about herpes?
Yeah, lady. What's it to you? What's herpes?
Herpes basically is cold sores on your mouth, blisters. It can be quite painful.
Say what? Mine hurts like crazy, girl.
How long have you had this?
Oh, it won't go away. It keeps coming back, and I don't know what I'm doing wrong. I can't get rid of these herpes on my face.
You must have recurrent herpes.
Tell me more about it.
Well, you can have a primary herpes infection, so basically the herpes shows up once. And if the virus stays in your body, you can have recurring episodes, so it'll break out either on the same spot on your face or in a close region.
Whoa!
Seriously.
A virus?
Serious.
Like a bug that I just picked up somewhere?
No, it's basically from skin to skin contact, or if you're kissing somebody, be from saliva. And also, if you're doing anal or vaginal or oral sex, you can give it to your partner that way too. Seriously, I'm serious.
Oh, no.
Seriously.
So I was macking on this girl last week, and I had it. Do I have to see it? How do I know it's there? Is it always there?
The virus is always there. You don't have to see it to be able to transmit it. It can shed. The virus can still shed when you can't see it visually on your face. So you can still pass it on when you can't see the source.
So how do I get rid of it?
Well, as a matter of fact, we're by the Shoppers Drug Mart. I could go in and show you.
Sounds great.
Seriously.
Learning's fun!
Oh my god, there's so many options. What one do I use? There's too many to pick from.
Well, I'm going to say it's probably best if we go and ask the pharmacist. They'll know best.
Okay. Wow, there's so many options. How do I know what's right for me?
Well, everybody is different, and there are lots of options. It depends upon kind of how long you've had the cold sore, or if you're just getting the cold sore. Now, we have something that's quite expensive, and it's actually a thermal or heat treatment, and you buy the zapper, and then you can buy refills for it. Now, it is fairly pricey, but for anybody that is subject to having a lot of cold sores, and I would say probably over 5 or 6 bouts a year, it works quite well. The way it works, it is a heat zapper, as I said, and you have to use it on your cold sore within 2 or 3 hours of first getting those warning signs, which are usually tingling, a bit of irritation, soreness, that type of thing. Usually a person that has that many cold sores will certainly know the warning signs. That's right. So that would be one option. The other thing is, when you do feel the tingling, there are a couple of options that are less cheaper, and if you have it less frequently, that would be the way to go. The Lapactin is one that's been out for a fairly long time. If you get it right at the first warning signs, usually that works quite well to help to stop the virus from replicating, which just means that you'll have that cold sore a shorter period of time. So rather than having it maybe for a full 10 days, it'll get rid of it a lot quicker for you. Something that's a little bit more expensive than this one, and they say in any of the studies that they've done, and this has been available in the United States, Abreva, for quite some time, this will stop the replication of the virus, so shorten the time that you have the cold sore. It's supposed to be more effective than this, but it's also more expensive. So if you have the cold sore and you've had it for a little bit and you want to help dry it up, an old-fashioned remedy is this Fletcher's sore mouth, which has what they call alum in it. Alum works as an astringent, helps to dry up that cold sore. If it dries it, it will dry it up, and if it gets too dry, you have to put a little dab of Vaseline on, just so it doesn't crack and bleed on you, but it will help to dry it up. Another one that works fairly well, and it's like a heavy salve. It's almost like a thick Vaseline. it has a couple of ingredients in it, some camphor and some what they call phenol, which helps to dry it up and works as an antiseptic. So that's not that. Then there's something called homeopathy, which just means these are natural ingredients, and they're supposed to help shorten the duration of the cold sore and to help dry it up. There's that one. Then we have a whole series of what we call the zolactins. A couple of them are really just what they call a type of alcohol, which helps to dry it up. Once you've got it, it helps to dry it up. And again, if it gets really dry using it, you just use a little bit of Vaseline to moisten it up so it doesn't crack open. So there's those. This one is similar to this one, but the B stands for benzocaine, which is like a local anesthetic. So some people do get quite bad pain with the cold sore. So that would help take away that irritation because it would actually numb the area. Okay. Then there is this one, and this one I think it's similar to this one, but it has what they call a tetracaine, which is just another type of local anesthetic, and actually it's supposed to be a little bit more effective than the benzocaine.
Okay.
Then there's something called lysine, which is actually an amino acid. Some people that are use a lot of health foods buy actually lysine tablets, the amino acids. And there is a dosage, which I'm not sure of, but they've since come out with this ointment that's supposed to, again, shorten the duration. Not sure about the effectiveness of that one. And then if you really have a problem on prescription, you can get an antiviral, and there's a dosage that you'd use 2 grams of it in the morning and 12 hours later 2 grams, and it stops the virus from replicating, so shortens the duration. It's fairly expensive.
Okay, so how would you determine if you needed the prescription drug versus the over-the-counter preparation?
I think that if you were going on a trip or to a wedding or something that you wanted to make sure that you were going to get that virus stopped, that would be when you would go for a prescription. Or again, if you get quite a few, then somebody like that would keep a prescription on hand, where they'd have the tablets available, because you got to get it at the start, and you do the higher dose morning and 12 hours later a higher dose. So for somebody that had them quite badly and was going to do something really special, that they wanted to make sure it was going to work for them.
Yeah. Okay. So, and it sounds like the main objective of all of these is to just shorten the duration and dry up the actual sore itself, right?
That's all you can do, right?
All right. Thanks a lot. Thanks so much, Mim, for everything you've done. How was I supposed to know I had herpes simplex 1? I had it on my lips and I didn't even show it.
Dude gave away the virus and he didn't even know it. Peace!